Hello, sorry I'm a couple of minutes late. Okay, so today we're going to finish off the altitude information and hopefully start the information on exercising in the heat so that we can get that finished on Wednesday. Yes, Wednesday. I think this is where we had gotten to. So we were looking at these pressure gradients, particularly the one between the arterioles and capillaries and the muscle tissue, because at sea level we would have somewhere around a 60 millimeters of mercury gradient, but when we're up, so this is, what did we reckon this was, about 13,500 feet, so top of Wheeler Peak, yeah, a little bit bigger than Wheeler Peak, we're looking at only a 15 millimeters of mercury gradient, and so that makes it difficult. That means that we have a lot less oxygen available in the muscle tissue for aerobic metabolism. Okay, and so when we go up in altitude, it becomes harder and harder to do anything that's aerobic in nature. So some physiological things that we see occur because we've got low partial pressure of oxygen. The body responds by increasing heart rate at any given kind of workload to try to increase blood flow and increase oxygen delivery as much as there is, right? And also we'll see a drop in plasma volume, which means we see a drop in stroke volume, and that also stimulates the heart rate to go up. Higher blood pressures, lower hemoglobin saturation. So if you remember the oxy-deoxyhemoglobin graph, the graph would shift to the left in this case, right? So it's going to be harder to offload oxygen at the muscle tissue. And so because we've seen less oxygen use, then we see a drop in VO2 max, right? So those declines start around just under 2,500 meters, and then get worse. Like 2,500 meters wouldn't be dreadful, but you would start to see a drop in VO2 max and performance, and then gradually it's going to increase as you go higher. Increased blood lactate concentration. So think about what that means, right? If I'm seeing more blood lactate, that means that I have to be using glycolysis as an energy system and working anaerobically so that there's lactate being produced and dumped into the bloodstream. Right, so we have lower cardiac outputs, we've got lower oxygen consumption, and therefore a decrease in endurance performance. And then eventually, depending on how long you stay at the altitude for, so in the acute phase, we're going to see some dehydration and or likely to see some dehydration, and so that gives us, skews the ratio for red blood cells a little bit. Takes about 3 weeks minimum to start to see an increase in red blood cell production. So you have to be up at altitude for quite some time before you start to see the erythropoietin kick in and stimulate more red blood cells. So we'll also see some changes in our breathing, particularly once we get to 10,000 feet and higher. The first thing that we see is that we start to breathe more deeply, even at rest, right? So we'll take a much deeper breath than we would normally. If we start to exercise, then that deep breathing on its own probably is not going to be enough. And so then we start seeing the actual rate of breathing increase as well. So we start to breathe faster as well as more deeply, right? At submax. Now, what the data says is that at maximal exercise, the ventilation is quite similar to what occurs at sea level. So these changes that we see at submax exercise flatten out when we're at max exercise, and so that seems to represent an upper limit to what that individual is able to do from a pulmonary, from a breathing standpoint. Okay? And then because we're breathing faster and we're breathing more deeply, then we blow off some carbon dioxide, so we start to see that situation that we talked about with the swimmers, where we blow off carbon dioxide. Again, another adaptation is that eventually the kidneys will excrete bicarbonate, which is one of the ways we transmit carbon dioxide in the bloodstream. So the kidneys will start to excrete that, and also bicarbonate acts as a buffer, so we get rid of bicarbonate. Right? So over time, with either acclimation or acclimatization, we're going to see some adaptations that make our responses to being up high better, but they're never really going to be, not ever really, they're never going to be the equivalent of what they would be at sea level. Right? So one of the other things that starts to happen is that because we are working more anaerobically and using glycolysis, we increase our reliance back on our carbohydrates, and as we mentioned earlier, we see an increase in blood lactate levels. Right? So we're using more glycogen through glycolysis to make ATP. All right? So remember though that if we're using glycolysis, that means that we can't work for very long before the environment turns to acidic for us to continue making ATP. Right? So this switch back to glycogen is a negative effect, right? Because it slows us down over time. People who have spent time at moderate or high altitudes are able to rely more on their fat stores to keep making ATP than people that have gone up relatively recently. So that whole idea of being acclimatized becomes very important, because if I can keep using fats as an energy source, that means that I'm maintaining aerobic metabolism and I can keep going for longer. Right? Oops. So what happens to performance? Let's have a look here. So short duration performance, sprints, power events, throws, jumps, don't have very much performance decrement at all. It's really only aerobic activities that get affected. So the effect of altitude on the anaerobic performances that are power related is minimal. In fact, you often see world records in anaerobic events at altitude because the air is less resistant, because there's less pressure, and so someone can run a little bit faster, or the thing they're throwing goes through the air faster, and so quite often see, as I said, world records. I think the Mexico Olympics, can't remember what year that was, but long before your time, there were many world records broken at that Olympics. Right? So for anaerobic people, it's more about, you know, psychological factors. Do they think that being at altitude is going to be a problem, and things like that. Our long duration performance, though, is pretty dramatic. So this graph that's in the book gives us an idea of what can happen in the long events. So in the short events, so this is, I can't see it even with my glasses on, that's 200 meters to 400 meters. We actually see improved performance, and then anything over 400 meters, we're seeing a drop in race time and speed. So the adaptations that we make, like the hemoglobin increases, we start to increase the amount of hemoglobin that's available in the body, and therefore we can pick up more oxygen. That will improve performance, but you're not going to get to where you would be at sea level, as I said. And so the idea is that if we can live high enough to obtain the benefits of long-term adaptation, but train low enough that we can ensure we don't see detrimental performance in our training practice, right? So, for example, maybe you could live in Ruidoso, because Ruidoso, I think, is about 7,500 or 8,000 feet, and maybe train in Roswell, which is quite a bit lower, right? So that would be a way of trying to get the most benefit from the altitude without training at altitude and wrecking performance too much. Okay, so a quick little bit about negative symptoms and illnesses that can happen at altitude. The first kind of level of sickness is acute mountain sickness, AMS, and you've got to keep an eye out for the symptoms. So if you have a look at box 12.4, no, box 12.5, box 12.4 is talking some more about AMS. Box 12.5 has the signs and the symptoms, but you've got things like you might lose your appetite a little bit, or a lot of people have trouble sleeping until they've acclimatized. Some people get a bit dizzy or lightheaded. Some people will actually feel nauseous. But none of these are like overwhelming symptoms, and so sometimes we don't pay enough attention to them, but it is a pathological condition, right? There is something happening in your body that is creating these symptoms. So symptoms can persist from 2 to 7 days. So it can be up to a week. So that could, if you go up to Cloudcroft for the weekend, your whole weekend you could have a background headache, or you might not sleep very well, right? Really the treatment is just to rest, don't do anything that's too high exertion, or come down, right? Those are your choices. Dehydration can occur much more quickly at altitude because of the evaporation of the water vapor in your throat and your breath and things like that into air that is not holding as much water as it does lower down. Right? So we have to make sure that our drinking behaviors are appropriate to help us with these symptoms. And there is a drug, which I'm not sure I can say, acetazolamine, which can prevent the side effects of, these side effects of mountain sickness, if you need to. What I don't know is whether acetazolamine is a banned substance or not, or if it's allowed. So one of the reasons I say that you have to be a little careful, be watchful of each other or of yourself. If it's possible that you're suffering with acute mountain sickness, because that set of symptoms can deteriorate and become much worse quite quickly, especially if you continue going up in altitude at a relatively fast pace. So, you go from 7,000 feet to 13 or 14,000 feet overnight, then you could have some problems. So there are two much more dangerous versions of sickness that can occur with altitude. The first one is HPE, so high altitude pulmonary edema. So this is life-threatening, and what happens with HPE, with the pulmonary edema, is that you start to see water move across the membrane and into the lung tissue, and that makes it very, very difficult to breathe well, if at all. Then there's another version, and these can happen simultaneously or on their own, right? And the next one is HACI, high altitude cerebral edema. So this is accumulation of fluid in the cranial cavity and on the brain, right? So again, life-threatening, and both of them need pretty immediate attention, but the cerebral edema is really, really urgent. You have very little time to get this person off the mountain if they've developed HACI. So it says here, untreated patients can die within 48 hours. So you really don't have a lot of time. This picture shows you, and I've not seen this before, so when I was researching this, I was like, wow, that's cool. So this is at one of the camps at Mount Kilimanjaro. So Mount Kilimanjaro, and I don't remember, I know this, and I can't remember, is very high. And so what they do is they have camps set up, so they have base camp. If you're going to try and climb Kilimanjaro, you go to base camp, you have to stay there for an amount of time to give your body a chance to acclimatize some, and then you go up to the next camp and wait, and then you go up to, and then you can climb, kind of deal. So what they have is, it's like a lightweight rubber bag, and it acts like a hyperbaric chamber. So you can put the person who's got HAPI or HACI into the bag and kind of zip them in, which gives me the heebie-jeebies because I'm quite claustrophobic. And then you pump, you use a foot pump to pump in oxygen into the bag to help the patient's oxygen saturation levels until you can evacuate them. You don't have very long to evacuate them, so this is not a instead of evacuation situation. This is a can we keep them as safe as possible until we can evacuate them, right? We're waiting for the helicopter to come, okay? So we've only really in the last 30 years begun to understand how these occur. And certainly HACI is the least common version of altitude sickness. Only 1% or less of people that go up in altitude are going to develop HACI. But it does progress very, very rapidly. You've got fluid pushing on the brain. This individual is likely to fall into a coma. And if the brain herniates, if anything bursts, you know, they got some kind of stroke or worse, then they're not going to survive. And so, you know, even 24 hours is vital, right? So to reduce susceptibility, and this always makes me laugh a little bit because it's not very realistic, right? So the main suggestion is that we go up in altitude slowly, right? We don't go up 7,000 feet in one day. So really we should go up just under 1,000 feet per day once we get to 10,000 feet. So if we go to Cloudcroft, we should be okay. But if we're going to go up from Cloudcroft, we should only do it about 1,000 feet a day. Well, that's a lot of additional time, right? Particularly if you're a skier or something and you only have a 4-day weekend, right? So I think the suggestion is more geared towards this kind of environment where you've got mountain climbing going on rather than recreational skiing. I could be wrong, but that's kind of my interpretation. The next one, though, is important that you limit your initial exertion. So
for example, let's say that you were going to take your team from Portales to Cloudcroft to train for a week, right? You've got to understand that the first couple of days, at least, is going to be very, very hard work, much harder than normal. And so you're going to have to plan for that by decreasing the intensity and the volume of work that you're expecting for those first few days, right? So I'll give you an example, a personal example. We like to go backpacking. We don't do it often enough anymore. 10 years ago we went very frequently, but we don't go so often now. But if we're going to go backpacking for 4 or 5 days in the wilderness area, then we try to plan for the fact that the first day or two we're not going to be able to do as much mileage as we would like to. So where's the next water stop on the map? Because in New Mexico, all your backpacking, hiking trips have to kind of plan for a water stop. Where's the next spring? Where's the next little tiny stream, right? And again, hydration behavior comes up all the time when we're looking at environmental issues and when we're looking at health issues. This hydration behavior is really crucial, that you're disciplined about your hydration. So what adaptations do we see and how long do they take? All right, so in the short term, which they would consider somewhere between 3 to 6 weeks. So remember, at 3 weeks, we start to see an increase in red blood cells and therefore an increase in oxygen carrying capacity of the blood, right? So we see increases in pulmonary ventilation. We see an increase in the release of erythropoietin, which stimulates the red blood cell production. And so we get an increase in hemoglobin, other hematocrit, and plasma volume goes up after the initial drop, all compared to what they would be at sea level. So one of the ideas is that, if we're going to compete at World Championships that's going to be at sea level, can we train at altitude, get this additional hemoglobin, and get down to sea level and compete while I've still got this additional red blood cells and additional oxygen capacity, right? Long term, so more than 3 months, more than 12 weeks, we start to see increases in the density of mitochondria, particularly within our type 1 muscle fibers, but even within type 2s you'll see, type 2As you'll see a few more. Capillary density increases, so we throw out more blood vessels so that we've got more surface contact between the blood and the muscle to dump oxygen across. Let's see, cardiac output eventually will go back up a lot because of this plasma volume increase. Right? With all these adaptations though, remember that we're not going to see the same kind of endurance performance that we can have at sea level, right? So then we have some decisions to make about how are we going to manage that, right? To acclimatize, so acclimatization, the one that has the Z in it, is you are adapting to a natural environment. So I go and live at altitude. Acclimation is an artificial environment such as a hyperbaric chamber, right? the same adaptation but without going to altitude. Okay. So there's some different strategies that coaches use to deal with altitude. One that the book mentions is that they use an intermittent training program. So they go for a week to 14,000 feet and then come back down some. Individuals who live at moderate, so moderate is anything over 5,000 feet. So we wouldn't really count, we're close, but we wouldn't really count as moderate here in Portales. So even if we don't go and live at high altitude, if we live at moderate levels, we're going to do better at a competition that is at high level than someone that's coming from sea level, right? So we get some adaptation for being at moderate levels. We just don't see the same degree of adaptation that you get if you go up really high. So teams then have to make some decisions, and this is where it starts to get a bit tricky, I think, because you know, there's money involved with acclimatization because I've got to go up at least 3 weeks ahead, preferably longer, right? That costs a lot of money. I have to live somewhere, I've got to eat, right? So some teams will arrive just 24 hours before whatever the meet or event is, so that there's enough adaptation, like they don't lose their appetite. They maybe don't sleep well the first night, but they're okay the second night, depending on how high it is. So that they compete and they get out really quickly, so to try to minimize the risk of developing altitude sickness, right? Especially, the book points out, if you're in an anaerobic event, so you're a power athlete, then not sleeping well, losing your appetite, or feeling a little bit nauseous is going to have quite a negative impact on your performance, and there's no benefit to being up at altitude to gain adaptations because they don't impact your event, right? If I run 100 meters, having more red blood cells makes no difference whatsoever. Right? So you've got to think through. It's not an overall team. It's kind of an event scenario as well. Okay. And in, I think it was chapter 15, 17. The ergogenic aids chapter that I had you watch a lecture on last week, we talked about blood doping in that lecture, which is the phony way to increase your red blood cell count, right? And that's banned. It's cheating. It's also highly dangerous, particularly the EPO injection rather than the blood transfusion. Very, very dangerous strategies. The hypoxic tents are controversial at the moment because I don't know. I think that they should be controversial, that there should be a lot of questions asked about them because they're expensive pieces of equipment. And so you immediately have athletes who don't have that kind of income or money, that could not have access to a hyperbaric or a hypoxic tent, right? So then the people that have got good funding have an advantage. It's not blood doping. I mean, it's currently legal, but it's still an advantage that not everybody has access to. So there is quite a lot of disagreement about whether or not athletes should be able to use hypoxic tents. So, questions?
I don't think so.
No? Okay, so we're going to move on to then the challenges that your body faces when we're exercising in the heat, in hot environments. So heat stress is when we're challenging the body to dissipate excess heat that we're creating from exercising and working out, right? How do we get rid of all that additional heat when we're in a hot environment, all right? So hyperthermia is the medical term, right? Hyper, remember, is too much. Hypo is too little. So hyperthermia is too much heat, right? So that's the technical name. So we're going to look at thermoregulation, which is the ability of the body to maintain a constant internal temperature. So humans have that ability within a range. Other creatures don't, right? So fish and lizards are not homeothermic. They have to, lizards, lizards and snakes have to be out in the sun to warm up. Okay, so that they can hunt and eat, all right? So, thermoregulation, that's not meant to be there. Let's put that up. Oops, it's a little large. I added some stuff here. So, thermoregulation is maintained in the body through the use of receptors that can pick up the change in temperature in the blood, for example. And we have these receptors in the periphery, they're in our skin, they're underneath our skin. We have a lot of receptors within our abdominal cavity. And we also have receptors within the central nervous system, so within the spinal column and within the brain. So the hypothalamus that we talked, was this class I think, we talked about hypothalamus, is acting like a thermostat, and so it has receptors that will say, okay, start shivering because you're too cold, or start sweating because you're too hot and you need to get rid of some of this heat. There are receptors in the brainstem and there are receptors in the spinal cord, as I mentioned. And I'm pretty sure we come back to the heat stress index later in the chapter. But just in case you've heard that term, the heat stress index is a combination of the temperature and the humidity, and it's used to determine physiological stress. So the athletic trainers, for example, will have a ruling about if the heat stress index reaches this number, and I don't know what that is, but if it reaches this number, no one can go and train outside. They will have to organise their training indoors, right, in a controlled environment. So the thermoregulatory stress is a combination of the temperature, the relative humidity that come together for this heat stress index, and wind speed, which we have a lot of here.
put this up bigger. There we go, that's better.
So the body has to have a way of getting rid of this additional heat that builds up when we're exercising, because we only have a very limited window of tolerance within our bodies for an increase in temperature. Okay? So we have 4. Convection is where, so convection would be like a fan that was blowing over you, or a shower where there's cooler water running across your body. So anything where you've got something moving across the surface of the body, right? The second one is conduction, where we have actual contact between surfaces. So in not the shower, because that would be convection, but if you use a cold water bath and you're submerged in the bath so that your whole body is in contact with the water, that would be using conduction. Okay. Radiation is when molecules that are moving around emit electromagnetic waves. So radiation is much worse at altitude, and that's why you are at risk of sunburn even if you're up skiing in freezing temperatures and tons of snow and ice. Right? When it's a hot day, then our ability to lose heat via radiation is decreased immensely. So at normal kind of temperatures, what's normal? I don't know, I guess maybe anything from 55 to 75 or 80, I'm not sure what they define as normal. But we can lose about 65% of body heat via radiation. But when it's really hot environment and we don't have a very big gradient, then heat loss can drop down to as little as 4%. So again, our gradient idea that we've had come up now several times in different areas plays a role here again, both for radiation and for evaporation. So evaporation is the most common way we get rid of heat. It's typically very effective. You know, we start to sweat. That water sits on our skin, it turns into vapor, and as it vaporizes, it takes heat away from the skin at the same time. Which can be a problem, as you will see. Okay, where are we? A couple of minutes. All right, let's do another slide here. So circulatory responses to the heat. So what happens within our cardiovascular system when it's hot? Okay? So we see an increase in heart rate and an increase, therefore, in cardiac output. Remember, cardiac output is heart rate times stroke volume, right? So if heart rate goes up, cardiac output goes up. And we start to redirect blood flow from the muscles, from the organs, out to the periphery, to the skin, so that we can dissipate heat through radiation and cool the blood down. Right? So you might see a conflict if you're trying to do very high intensity aerobic work when it's very, very hot, because your central nervous system is like, wait, I have to move this blood to the skin, but these muscles are working really, really hard. Right? we are can hugely influence how well you manage the heat, right? So if I'm a larger person, then I necessarily have greater heat production, right? Now, that larger body mass doesn't necessarily have to be fat mass. It could be a massively big muscle football player, right? So what they find is that the ratio of the volume of the person, which generates heat, to their body surface area where you can dissipate heat, is less favorable for certain positions in American football, right? So certain positions are going to struggle more when you are training or competing on a hot day than others. So the quarterback is relatively small, their volume to surface area is much better, that ratio is much more beneficial than the huge big linebacker. Are they the big guys on the team? If you're carrying extra body fat, then great in the winter, right? When those of us that don't have a lot of extra are freezing our buns off and you're walking around in a t-shirt going, oh, it's warm in here, right? That's great. That's what my sister's like. It's so warm in here. It's dreadful sharing a hotel room with her because I'm always cold and she's always boiling and we never can agree on the temperature in the hotel room. So, you know, the more body fat I've got, it acts like a down blanket, right? However, that might be beneficial in the cold, but in the heat, it becomes a problem because that extra body fat now acts as insulation, and that makes it harder to dissipate heat. So we'll finish that slide off on Wednesday, and we'll also look at heat stress illnesses and a couple of other items to do with the heat adaptations and things like that. And then, as I mentioned last week, you guys are going to have to cover the cold on your own. I will try to remember to double check that I do have that PowerPoint up. But it's relatively, if you look at it in the chapter compared to the other two types of environments, the cold has relatively little information about it. We do see some performance changes in the cold, but we don't adapt to the cold. So we don't have that piece of information to work with as well, right? We don't have any adaptations there. Okay, any questions? It's really cool, this chapter. I love it because being here in New Mexico, everything they talk about in this chapter is relevant, right? Everything. And so it makes it that much more interesting, I think, because we can go, oh yes, I remember when. Or, oh, this summer I'm going to go up to Wheeler Peak, so now I need to remember all this altitude stuff. Okay. So, have a great afternoon, and I will see you on Wednesday. Wednesday,